Hello, everybody. I am Dr. Narayanan Balakrishnan, and I am a senior resident at Sri Ramchandra Medical College and a consultant glaucoma specialist. I've been trained at Shankar Nethralaya, and I'm here to talk on the World Glaucoma Week about a few frequently asked questions by many of our patients regarding to their treatment in glaucoma. First, I'd like to address the most important question which most of our patients ask. Is glaucoma curable? Is our disease curable? The answer is no. Glaucoma is not absolutely curable. The only thing you can do is to prevent the progression of the disease. We can halt the progression of the disease with timely management, regular follow-up, diligent use of medications, and good compliance to treatment. You always have to follow with your ophthalmologist when they ask you to come, and also by using the drops regularly as advised by them, including refilling the drops once they're finished. If you stop using the drops by your own wish, then the disease tends to progress. But there is no absolute cure, except in some types of glaucoma where only the pressure is raised once in a while. Then there is a chance that the pressures can be reduced and you can be off treatment. But with most types of glaucoma, there is no absolute cure for the disease. There is only a halt in progression and maintenance of vision. What are the symptoms that I can get when I get glaucoma? What do I see? Most times, that is why glaucoma is called the silent thief of sight. You do not see any visible change in your eyes. But how do I know my glaucoma is progressing or not? The most important thing is to visit your ophthalmologist regularly. All patients above the age of 40 with family history of glaucoma, with use of, if you have steroid medications that you've used, if you've had any history of injury to the eye, it's better you visit an ophthalmologist to screen for glaucoma. And if you've been told by your ophthalmologist that you are at a higher risk for developing glaucoma, or you have a risk factor for developing glaucoma, maybe like an abnormal nerve head or some change in pressures, then it is better that you visit your ophthalmologist as they have advised you. The next question is, I have been advised laser for both my eyes because they said the drainage channels are narrow. What kind of laser is this, and is this going to cure my disease? Well, mostly if they say that your drainage channels are narrow, they mean that there is this minute pathway in both your eyes through which the fluid inside your eye, which is responsible for maintaining the pressure, is become very narrow. It can happen with increasing age, with increasing cataract, or sometimes in some people it is just made like that. So as this continues, these channels become extremely narrow and there's a chance for pressure to rise. And this chance increases as the channels get more narrow. So when there is an absolute indication that you need the laser for both the eyes, then you have to do it. That reduces the chance for you to develop glaucoma significantly. If your drainage channels are narrow and you have already developed glaucoma, it does not cure the disease. It can only halt the progression. But if your drainage channels are narrow and you do not have any signs of glaucoma and you're only a suspect, then it is better that you undergo the laser procedure to reduce the chances of you developing glaucoma. So that is about the lasers for the closed type of drainage channel. Some of the other patients ask me, I have some burning or stinging with the medications. Can I stop? Never stop any anti-glaucoma medication by yourself. If you have been prescribed a medication by your ophthalmologist and you have an adverse effect, or you feel like you are not able to tolerate the medication, please come to the ophthalmologist and they will look for the signs and symptoms of drug allergy and give you suitable replacements. They might also help you to reduce the chances of developing severe allergies, severe burning and watering by adding some lubricants or anti-allergic medications or sometimes even steroids. So it is very important you come back to your ophthalmologist and only they change the drops and you never stop it by yourself. I have some people say, how often should I follow? That depends purely on the disease. It depends on what stage of disease you have, what kind of disease you have. So it can range from anywhere between 1 month, 2 months, 3 months, 4 months, 6 months. Some people even we call weekly. So it is very important that you follow up with your ophthalmologist as they have asked you to follow up. The next question is, I don't find any benefit with my drugs, so I stopped it myself. That is, you will never be able to identify the benefit that your drug is providing to you. That can only be checked by us when we check the intraocular pressure. So you have to come here, get your pressure tested. Sometimes even if if it is very far away from your primary center, go to another center, check the pressures and inform us. And then maybe we, in consultation with what we have seen in the local doctor, can change your medications. But never stop medications thinking you have not gotten any benefit. Some people say my vision is not getting better, hence I stop the medication. Should realize that glaucoma only affects peripheral vision. If there is a central vision problem, it is because of something else, and these drops are not going to help you make your vision better. Another common question is that is there any surgery to cure this disease, and why not get surgery than to use medications repeatedly? It is very important to note that there is a surgery for glaucoma. There are different types where we have what is called a trabeculectomy, where we create a drainage, alternate pathway for the drainage, or we have glaucoma drainage devices where we put an implant in the eye. But all these come with their own set of complications and are only undertaken when medical therapy has failed. And when you do these surgeries, there is always a chance that you can have recurrence and might require medical therapy again. And they come with their own set of vision threatening complications. So the risk, we only outweigh the risks and do the surgery, but that is not the primary option. Some of the other patients asked me about what are the about the last visit. I woke up very early and I came in the morning. I was not able to put the drops in the morning. What do I do? You should always realize when you come to visit your ophthalmologist on the day of your examination, it is mandatory that you use your medications. If you do not use the drops in the morning of the examination, we will not know the actual intraocular pressure that you have. You have to use the drops as they have been advised. On the day of the checkup, you cannot say I woke up early and did not use my medication, then we will not be able to know if the treatment is working properly. And if the pressure is raised, we might have to restart the medication or add another medication. So it is very important that you use the medications as advised, even on the day of the checkup. Even if you have to travel, use it during your travel or prior to your visit. So it is very important that you use these medications. So knowing about compliance and adhering to medications not only means using medications, but using it exactly like my doctor said, and refilling prescriptions as and when my bottle is over. Your role in fighting glaucoma is just as much, or if not more, than the ophthalmologist himself. And following medications and practicing the do's and don'ts of glaucoma is just as important in fighting with the disease as much as our role in treating it. Thank you.